Hello, good people. Welcome once again. My name is Wesley Oseko, a healthcare provider and the founder of the African Health Focus. Our YouTube channel deals with matters health, where we discuss medical topics, and also we link patients to doctors, both locally and internationally. So you're welcome. Hello, good people. Welcome to our channel, African Health Focus. And today, I want us to have a discussion on a phenomenon that is very, very common in the western part of Kenya. When I'm talking about western, I'm referring to Kisii, Luo, Luyha, these three communities. And this phenomenon, well, it has impacts in our healthcare system. I don't know. Have you ever heard of people say, talk about the evil eye? Okay. Have you heard in your community of people who are known to have evil eyes? Like these people, if they look at your child, for instance, the child will be sick, and if that child is not treated, and they are referring to traditional treatment, that child will die. Now, this thing borders mythology, or is it a myth, and witchcraft, say, okay? Because now let's start. I don't know. I want to get this one from the comments from all of you. In the Kisii community, they call it's a phenomenon, and they call it Ebibiriri. Okay, so somebody will look at you with that evil eye, and what happens, you collect whatever is around. If it's then at that spot, if you have leaves there, you have sand or some branches, you collect those ones to your body. Okay, and the treatment allegedly is that they will do a massage on your stomach. As they'll do a massage on the baby, and the massage has to be with hot water. That hot water with a coin, and or some herbal medicine. And when they do the massage, allegedly, that they will collect things from your body like leaves, sand, branches, depending on what was in that area, in that spot, when that person looked at you with that evil eye. Okay? Now the worst bit on this story is that sometimes when this baby is sick that way, definitely the fevers are very high, and also they have difficulty in breathing. So definitely, as parents, the first thing they do is to rush the baby to the hospital. But when you get those people who know about these things, those who believe on this thing, definitely they will make sure that that baby is not treated. And they say if that baby gets an injection, that baby will die. That's the belief. So imagine a baby is brought to the hospital. The baby is very sick, very febrile. The baby is barely breathing, difficult in breathing. But the parents will insist that the baby should not be injected. Now this, I was trying to check out if this happens in other communities. I don't know, other parts of the world. And whether also this issue is taught in a medical school, because if a doctor is sent to, let's say, to the Kisii community in a hospital there, or let's say it's Western Kenya or even Luo, and definitely as their practice, if the baby is brought with all this, they want to manage the baby and give the injection. And they will be told, please don't inject our baby. And sometimes they even carry that baby and go away, only to come later. And when the baby is very sick, and most of them they die. So I will came across an article. Actually, it's not an article. Is one of the scientists who a student from Jomo Kenyatta University who had done her masters in epidemiology, and her thesis was on this issue. She was looking at the practice of traditional medicine, and she was looking at this phenomenon on this on evil eye. And of course, she did her study in a place in Kisii, Gucha. And from the survey and the interviews she performed, it was surprising that 85% of people believe in this phenomenon of evil eye. And they believe like the people who can look at you and look at the baby and the baby becomes sick, they are known in the community. Okay? And the only treatment is not the conventional treatment where the baby is given the medication in the hospital and such like things. It's traditional medicine whereby they get some herbs and do that massage I had mentioned earlier. This thing is very rooted, such that even the people who have been who have been saved, the Christians, people who believe in God, in Jesus Christ, or who are Christians, who profess to be Christians, still believe in this. And to prevent your baby from getting this evil eye, they do some traditional things. They clothe you with some red colored clothes, or maybe they tie with some beads, some beads, so that does not happen to you. Now the question is, because to be honest, on a very sincere note, is that there are so many babies who have died out of this because the parents will insist that their patients should not be attended to, and they can only get the traditional treatment. You see, if the case is severe, definitely the baby will die, and you will die watching. You will do nothing. I don't know what's your experience. I want to hear from the doctors who practice in those areas, Western Kenya, Luyha, Kisii, Luo, and I don't know, do you people believe in these things? How do you, like, somebody will look at you and you collect? Well, I don't, well, I cannot object completely that can happen, because even the devil is, has powers, just like God. The devil can do miracles. But how do you balance this one? Medicine and this kind of practice whereby the child is sick and they say that he has been looked at by somebody who has an evil eye. How do you do that? It's a big deal, and let's have a discussion. Do you believe in this thing? The researcher I was referring to is, she's called Monica, and she has done her thesis. Manotti, yeah, Monica Manotti, it should be. I think that she's the right article, and she had done her thesis on that. I wish to meet her so that she can also tell us what was her experience. Is it happening in another part of the world? Is it possible that somebody can look at you with an evil eye and you become so sick, and the only treatment is the herbal treatment whereby they do the massage and such like things? Now the other thing is, how do you balance the doctors? How do you balance between this myth and practicing conventional medicine? How do you balance? Let's have a discussion.